Ever since I was younger, I've always wanted to go into the healthcare field. My aunt is a doctor in India, and whenever I visited, I would go to the hospital she worked at. I was intrigued by the amount of people there and the illnesses they faced. However, a lot of the patients, being from lower class families, could not get the proper healthcare they deserved. This problem really saddened me, but I realized it wasn't just unique to India. This problem of inequality in healthcare exists in many places, even in the US. As I visited hospitals, it became clear to me that people were treated and viewed differently based on factors such as the insurance they have, gender, class, and race. It has been documented that race plays a huge role in the quality of healthcare received. As someone who is interested in potentially going into the healthcare industry one day, this is really disheartening. Although this issue is addressed in many medical TV shows such as House and Scrubs, many people are not aware of this issue and argue that it doesn't exist. However, research has shown that there is a disparity in treatment between white patients and minorities, especially Latin Americans and African Americans. Studies have shown that people of color live statistically shorter lives and often have worse health. Of course, doctors take a Hippocratic oath to treat patients equally. So why does this problem exist? Well, there are quite a few factors that play into this racial inequality in healthcare, and most of these are not due to lack of care, but because of barriers existing within race. These include socioeconomic barriers, language barriers, as well as the availability of healthcare in different regions. All of this has raised many questions. What other factors contribute to this inequality? What can be done to stop it? What is currently being done to eliminate racial disparities in healthcare? And how long will it be until equality does exist?